Luminesce Alliance is seeking to change the face of children's health across New South Wales, Australia and the globe. We are Australia's most groundbreaking, innovative and translational paediatric research alliance. Hello, I'm Catherine Greiner. I'm the chair of Luminesce Alliance, and we're a collaboration between the Sydney Children's Hospital Network, Randwick and Westmead campuses, Children's Cancer Institute, the Children's Medical Research Institute, and the Universities of Sydney and New South Wales. Our vision is to be the most groundbreaking, innovative, translational research hub that will improve children's lives not only in New South Wales, but in Australia and around the world. We do that because, quite simply, paediatric precision medicine is the unsung hero of children's health. Luminesce Alliance, through the investment of the New South Wales Government of $20 million, have been able to bring into New South Wales research talent and people from around the world because they want to be associated with the work that is happening here. We have innovation campuses both at Randwick and at Westmead, and we're working within those innovation campuses to make sure that our researchers are the best in the world. They have access to the best research.
The genomic revolution offers the possibility of doing things about many diseases, but the need is greatest and most immediate in cancer and in serious, life-threatening inherited diseases which particularly affect children. So through the Luminesce Alliance program, we have the opportunity to have an immediate impact on children with very serious diseases.
So we've got one-in-a-lifetime investments happening at both Westmead and Randwick. So we've got a couple of $1 billion going into infrastructure, but infrastructure is only as good as the people that work in it and the talent and the expertise that that brings. And so that becomes a magnet and an attraction for us to attract the very best talent and the greatest institutions in the world. And the network absolutely wants to have both our facilities as the best in the world. What that does is provide that impetus, that transformation to be able to attract that and grow that. And that's that partnership approach that we can take.
Lots of people talk about the importance of delivering the research that's in the laboratory into clinical care, and Luminesce is no exception to that. One of the advantages that we have is the capacity to deliver that in a more timely fashion than is currently the case. So instead of it taking 10 years to deliver the research, it might only take a couple of years. And that means a huge number of children benefit much earlier than they otherwise would. That makes us a real powerhouse.
We've been actually incredibly proud of seeing the impact of our precision medicine programs on changing the lives of children and families. Children like Jack, who benefited from being on our Zero Childhood Cancer program, which has been supported through the Luminesce Alliance. Jack had a cancer that started off reasonably benign. It was treated, but then he relapsed with an aggressive disease that was threatening his life. He was really within weeks. He was losing his sight, he couldn't walk, he was really at the end of the line. And then through the power of precision medicine, we were able to identify the specific genetic change in his tumour that we could then match with the particular drug that was targeted to his genetic change, and through that Jack had a remarkable recovery and many months on is now alive and well, leading a full life back in high school. This is really the power of precision medicine. We see it also with a child like baby M with an otherwise fatal motor neurone disease, who now again through the Spinal Muscular Atrophy Luminesce Alliance program is now meeting all developmental milestones and, all being well, going on to live a normal life. These are remarkable outcomes.
We are at the beginning of one of the biggest changes which has ever happened in healthcare, namely the introduction of the precision medicine revolution, which is going to affect every aspect of how we practice medicine and healthcare into the future. This could be an incredibly expensive exercise unless it is done in a highly evidence-based way. What we are proposing to do in Luminesce Alliance through the enabling platforms is to build the evidence base to do this in a highly cost-effective manner.
So neurodevelopmental disorders are incredibly common. They affect 10% of all children. And at the moment, our treatments are just supportive, predominantly treating symptoms and supporting families. So what these enabling platforms will do is provide us with the potential to approach things differently by approaching the mechanism of the disease, understanding what is actually happening to these children, to these children's brains, and then providing targeted treatments. And we'll be using the latest technologies, genomics, proteomics, as well as very good clinical care to do disease-targeted treatments.
So what we've done for children in New South Wales is deliver the first ocular gene therapy as a clinical therapy that's ever been done in Australia. And that's just made a fantastic outcome for those children because they're really excited. Now they can see stars, which they couldn't see before. There are many other children and families where there are currently no treatments, but with our research strategies that we're taking, we can use stem cell-based approaches, gene therapy approaches, and use these to understand the disease mechanisms and also develop new therapies for those patients so that they can also have better prospects for vision in the future.
So in the last couple of years, we have formed a platform of stem cell research in New South Wales. We can generate stem cells from patients and healthy individuals, and these stem cells are then generated into organoids. So organoids are mini organs that we grow in the lab, and they are the perfect human models to use for research, so precision medicine research. We then use these organoids to develop new therapies, and of course the development of new therapies is very important as it's important to the patient and also important to attract new commercialization and industrial partners to the state.
Today, the Luminesce Alliance has helped us improve health outcomes in kids through allowing us to build the computational infrastructure to really understand genomic data from children. So to build algorithms, databases, pipelines, all the tools that are needed to go from vast amounts of raw genomic data to pinpoint what went wrong in that patient's tumour. We focused on childhood cancer to date, but there's so many synergies that we can leverage from what we've built to help apply our technologies to children with rare genetic disorders, developing brain, you name it, a whole range of different disorders. So one of the goals of the enabling platform for Luminesce Alliance is to bring together disparate expertise in genomic analysis, clinical data extraction and representation, building high quality registries, data linkage, follow-up data, you name it. We can bring together a hub of the brightest minds in New South Wales and bring together the dream team to try and push the use of data to improve patient outcomes.
So what this means for the future and the enabling platform is that we've been able to demonstrate that we can identify and harness clinical information that's not routinely available from clinical sources, from biobanks, from DNA banks. And not only can we identify and collate them, but then also combine them with and link them to different health data collections. So now we have a history of a child's health from when they start treatment and they're managed, and then long term, and then in terms of how well they do post-treatment. And now for the future, what we can do with all of this data is really be able to ask questions that help us understand the clinical markers of childhood health and disease. And not only able to understand that, but develop treatments and interventions that are going to improve the health and well-being of children in the future.
Luminesce Alliance brings together a group of partners that have extraordinary capability and competitive advantage, especially around precision therapies for children in New South Wales and nationally. which we've established over the past 2 to 3 years. Luminesce Alliance partners have a beginning to end pipeline from understanding the basis of disease, developing novel therapies and delivering precision therapies both in trials and into the health system. It's extraordinary that what we have achieved to date. We're the only state in the nation that has delivered novel gene therapies at scale for children with spinal muscular atrophy, devastating life-threatening disorder, and for children with a form of genetic eye disease causing blindness.
Therapeutic Innovations for Kids, also known as THINK, is a program that will be embedded in the Precision Therapy Enabling Platform with the aim of building the drug discovery capacity to develop novel small molecule therapeutics tailored for childhood disease. Our commercialisation activities will turn hundreds of millions of dollars in milestone and royalty payments to the New South Wales economy.
A lot of people are really surprised to learn that 25% of children with a serious medical condition actually also have a mental health condition as well. And so our Psychosocial Platform aims to describe the problems that young people are facing and, most importantly, fix them too. So we develop solutions that are relevant for all children with serious illnesses across many different diseases, and then we trial those, evaluate them, and then implement them into the health system to hopefully improve outcomes, not just for children, but also for their parents and their brothers and sisters. This program will be incredible as it comes to fruition. We should have a group of young people who grow up through their serious medical illness but still go on to thrive in society. And we should also end up with a workforce of health professionals who are able to recognise the mental health needs of young people early and then know what to do in order to provide treatment and prevention for those young people so that they can go on to thrive. We've been thrilled to lead this program of work for a number of years. It's truly world first and groundbreaking, so it makes us enormously proud to be able to continue that over the next few years.
Sydney Children's Hospital Network sees over 1 million children per annum. And what we're wanting to develop is a completely new way of working. If you like, a children's living lab. So what do we mean by this? We mean that actually every child that comes into our hospital will be delivered care that is absolutely cutting edge. And we will see the impact of that new and novel way of treating children in terms of their quality of life, how children, young people and families feel that the service actually delivers for their needs. What this means for your child is when they enter the Sydney Children's Hospital Network or other hospitals across the state, we can actually deliver care, precision medicine care, which is completely world first and groundbreaking, and actually evaluate, actually find out what the impact of that new model of care is for the child themselves, for the family, for their surrounding family such as siblings, but also what it takes to actually deliver this care from the perception of clinicians working with that family and how much it costs to deliver this care. The fact that we're able to do this is absolutely groundbreaking. This is the only children's hospital globally that is actually doing this scale of work.
Precision medicine will require not only research and development, but the delivery of advanced manufactured products suitable for our children and of course for adults as well. This will require a whole new industry, high-tech jobs, attraction of talent from all around the world, and economic benefits returning to New South Wales.
It's the profound impact, I think, on families of having a child who has a disability, that has a medical condition. That has an enormous ripple effect. That affects their schoolmates, it affects, their whole extended family. That tugs very much, it's so personal. And so I think there's that ripple effect that has. And so if you can intervene in that, and you can make a difference to that outcome, then you're transforming a life. And you know, that's a great responsibility to have, but it's such a great privilege.
We see these enabling platforms and everything that the Luminesce Alliance will be bringing together as attracting the brightest and the best. We see it as attracting industry. We see it as attracting investment. We see it as bringing the pharma companies in. We see huge opportunity for development and growth in the health sector and its partnerships as a result of the Luminesce Alliance enabling platforms.
In 5 years' time, everyone in government, everyone in bureaucracy, families, children, they will all look back and say, what a wonderful investment this has been in the health of children in New South Wales.
New South Wales is now the international vanguard of paediatric precision medicine. Through our close collaboration, our member organisations have accomplished more than they would have been able to do if they were working individually. There is still so much more to do. Please support Luminesce Alliance world-leading work in paediatric treatment and research. Help us revolutionise paediatric care in New South Wales, Australia and beyond.